Hello, Professor Randolph. This is Vera Clark doing an assessment today on my daughter, Genesis. My normal patient isn't available today, so she's reluctantly agreed to be my patient. We're going to get started. Today we're going to start with an assessment of the cardiac system. First, I'm going to identify the suprasternal notch, which is going to be located right on the top of the sternum. Let me see. Can you sit up for just a moment? Face the camera slightly. The suprasternal notch is going to be located in this V-shaped section right above the sternum. I'm going to come down to identify the angle of Louis, which is going to be right about here. I'm going to move over, and that is going to help me identify the second rib. Just below that, that will be the second intercostal space. Next, I'm going to have Genesis look straight. I'm going to identify the JVD, which is also the jugular venous distension. I'm going to look for any distension of her jugular vein, any bulging, which I am unable to identify. I'm also going to look for the cusps while I do this examination. I'm going to look at color, ulcerations, scars, pitting edema, or swelling. So Genesis, I want you to lay back, and I'm going to look at your jugular vein with your head at a 30, I believe it is a 35 to 40 degree angle. So I'm going to go ahead and put this pillow here. Go ahead and lay back. Put your arms to your side. Okay. Let me see. Lift up just a little bit more. Let me put this right under your shoulders. Okay, go ahead. Arms to your side. Okay. That is allowing me to turn your head just that way. Observe her jugular vein. Next, I'm going to do a hepatojugular reflux, which is going to have me press over the patient's upper right quadrant, which is going to be over the liver. I'm going to do that for 10 seconds and then check for the rise of her jugular vein. So if you could just look that way, I'm going to identify where I see her jugular vein currently. There it is. I'm going to locate her upper right quadrant, and I am going to press for 10 seconds. Relax. I'm going to release, and keep your head that way, and I'm going to observe any changes in the jugular vein. I'm also going to observe if there was a rise of the jugular vein, which I did notice. Next, I'm going to check her apical impulse. Which is going to be located on the patient's left side. I'm going to make sure she can see. Is that my paper? My paper there. which is going to be located mid-clavicular. Her clavicular bone is here. We're going to come right down to the 4th and 5th intercostal space. And Genesis, I'm just going to, okay, put your arms to the side. I'm not going to expose your breast, I promise. Okay, so I've identified her apical impulse. There's no heaving. There's no lifting. Okay. I don't see any abnormal coloring, ulcerations, no scars, no pitting edema, no swelling. I did not identify any of those in her neck where the jugular vein is present as well. Okay. Next, I am going to check with my finger pad the location, size, amplitude, and duration of her apical impulse. The amplitude feels like a short tap, and it is 1/2 of a systole. Okay. I am now going to palpate across the precordium, and I am going to feel for any heaves or thrills. So to start that, I'm going to place my hand right here. Okay, relax your arms on to your side. You can do that too. Take a breath, relax. Okay. All right, so I'm going to feel here. I'm going to feel here. Okay, and I'm going to come here. I do not feel any heaves or thrills. Normally we would not feel any of those things, so that's good. Next, I'm going to check the carotid pulses. Normally, we would do that for a full 60 seconds, but I'm going to check hers for just a few seconds. So Genesis, you're going to feel my 2 fingers, one on each side at a time, assess your carotid pulse, okay? Let me make sure that she can see. Let me bring the camera over here, Professor Randolph, so you can see that I've got the correct location. Okay, ready? Carotid pulse. I have identified it on her left side. Going to come over here to the right side. I have identified it on her right side as well. Okay. Next, we would normally percuss to determine the borders of the heart, but that is deferred. According to your lecture, that's not commonly performed anymore. So we are going to go ahead and move on to the auscultation. So for this Genesis, I'm going to have you sit up, okay, and face the camera. Perfect. If you could kind of just go at a little bit of a degree angle so you're perfect. Thank you. Okay, so the first thing we're going to do is identify S1 and S2. S1 is the tricuspid, S2 is the aortic. Goes aortic, pulmonic, Erb's point, tricuspid, and apical. Stands for all practitioners earn their money. So we are going to start with identifying with the bell. S1, which is the tricuspid, which is going to be I'm not hearing that yet.
Is that bad?
No, you're alive, promise. Okay. Rate and rhythm are normal. Okay. Going to move over to S2, which is the aortic, using the bell of the stethoscope, which should be right about here. I believe that I should be using the diaphragm. So let's try this again. I'm going to use the diaphragm for heart sounds, the bell for carotid sounds.
That's it.
Ah, much better. Very good. Okay, we're going to go here to the aortic area. Rate and rhythm are normal. Okay, now I'm going to compare S1 to the carotid artery. S1 is located in the tricuspid area. I'm going to assess her carotid pulse at the same time. They should be equal. Let me try this side. Yes, those are equal. Okay, so using the bell side of my stethoscope, I'm going to listen to the carotids for any bruits. So, lift your head up slightly. Need a yawn?
Huh?
You needed a yawn?
Yeah.
Okay. All right. Let me go ahead and listen. So I'm listening to the carotid arteries. I don't identify any bruits on that side. Okay, I do not identify any bruits on the left side either. Next, we're going to move on. I'm going to use the bell and the diaphragm over traditional landmarks. I believe that you wanted us to go over all of the landmark areas once with the bell and once with the diaphragm. So I'm going to do that. If it's overkill, I apologize. I just want to make sure that I am complete in my assessment. So we're going to start now again using the diaphragm side, assessing the aortic area. Which is going to be the second intercostal space. Okay. That sounds good. I'm going to move over to the pulmonic area. Sounds good. I'm going to go down one rib space to Erb's point. Sounds good. I'm going to go down now to the tricuspid area.
You're always going to the tricuspid area.
Healthy, sounds good. Then we're going to go to the mitral area, which is apical. Sounds even and regular.
Sorry.
Okay. Heart sounds are normal. Not hearing any murmurs, blowing or swishing sounds. Okay, we're going to now assess those same areas using the bell of my stethoscope. Aortic. Pulmonic. Erb's point. Tricuspid. And mitral. And it's pretty hard to identify heart sounds using the bell side of the stethoscope. Okay, so now we're going to move on. I'm going to assess the peripheral vascular system. So the first thing I'm going to do with my patient is I'm going to assess both all four extremities. Go ahead and extend your legs out.
I'm up here. You know it, right?
Okay. So I'm going to assess for color, which is normal. Any ulcerations, scars or lesions. You've got a little scar. What happened there?
I don't know.
Pitting edema, which I do not see, and swelling, which I don't see any
I have
swelling.
one right here.
What? A mosquito bite?
Yeah.
Welcome to Kentucky. Okay, so next I'm going to palpate the upper and lower extremities. I'm going to check the 4 T's: temperature, texture, turgor, and tenderness. So Genesis, if you want, you can lay down on your back. Okay. I'm going to use the dorsal side of my hand. I'm going to come over right this way to assess her temperature. So can you go ahead and put your, there you go. Put your leg straight for me. Okay. So I'm going to assess her temperature using the dorsal side of my hand. Temperature feels good. Go ahead and put your arms to your side. Temperature feels good in all extremities. Okay. Skin is smooth. There's no scaling or lesions. I don't feel any rough patches. May I see this other arm? Turgor, Genesis, can you place your arm right there? I'm going to pinch the skin. It bounced back right away. So that's good. And do you feel any tenderness when I touch your arms or your legs?
What do you mean?
Do you have any tenderness when I touch or feel your arms or legs?
What's tenderness?
Like sore? Is it like, oh, that hurts, or it's like kind of sore?
I hear a little bit, but that's normal, I think, because I'm always on the phone. Yeah, I'm asking.
Thank you, I'm sweating. Okay, next I'm going to do the capillary refill.
It is a little sore right here.
We'll get there, or we'll talk about it off camera. Next, I'm going to do the assessment of her capillary refill. So I'm going to pinch your finger for just a couple seconds. And when I let go, the color should go right back into your nail bed. So, yep, right back. All right, next, we are going to check your toes and do the same thing. So I am going to, let's see, can you bend your knee so she can see your toe? Perfect. Okay, I'm going to gently pinch your big toe, and I'm going to look at the capillary beds of your big toenail when I release. Ready, go. Excellent. Okay, go ahead and put your leg back. Okay, so we are going to check the arterial pulses now. All of them except the carotid need to be done at the same time, so you're going to feel me palpate your arterial touch.
Can't you say touch?
Professionally, we say palpate. All right, so to start with, I'm going to do your temporal,
Should I put my hair back?
which are, I want to make sure she can see. Can you hold this up
Yeah.
and let her see that I am assessing your temporal or pulse? Please.
So she can see.
Excellent. Definitely feel your pulse there. Okay. Next, we are going to do your carotid. So hold it again for me, but I'm going to do one side at a time. Excellent. Other side. Perfect. Thank you.
Here.
Okay. Okay. Next, I'm going to assess the brachial pulses. And, oh, I needed to note on the temporal and the carotid pulses, they were definitely a 2+ for both of them.
Is that bad?
No, that's good. So the brachial pulse is going to be felt inside the inner elbow on the ulnar side. And I'm going to make sure that you can see that I know where that is. It's going to be here and other arm here. Okay, so I'm going to go ahead and assess. Go ahead and put your arm down.
Aren't you supposed to be showing it?
I am, aren't I?
No.
There we go. Okay, go ahead and relax your arm. I feel that at a 2+. You know what? I need to do these both at the same time. So Professor Randolph, I'm going to have to put my camera right here. Trust that I know where I am assessing the brachial pulses. Okay, so you're gonna feel me both ulnar sides, both at the same time. Go ahead and relax your arms, just right there.
I can't.
That's good. Hold them. Excellent. Okay, now I'm going to move on to the radial, which is going to be on the inside of your wrist.
My radio.
No, radial. So that's going to be
I can't bend this.
right here, and I'm going to assess them both at the same time. Okay, those are being felt at a 2+. Next, I'm going to assess her femoral artery. So Genesis, you're going to feel me assess the artery that comes down right in here, okay? I'm going to do them both at the same time. Might be a little ticklish. Okay, definitely feel them, and yes, they are more of a 1+. Next, I'm going to assess the popliteal, which is behind the knee. You can keep your legs relaxed. Okay, go ahead and just relax. I'm going to assess these both at the same time. Those are a little difficult to find. Okay, I've located that, and definitely a 1+ as well. Okay, so now we're going to do dorsalis pedis, which is going to be the top of the foot. It's going to be right here and right here. And Genesis, okay, I'm going to make sure she can see. Those are going to be located here. And I'm going to do both of those, but I need both of my hands. Ready? Okay, my mistake, Professor Randall. They're actually a little bit more distal than what I initially showed you, but I have located them and I feel them at a 2+. Okay, so now we are going to do the posterior tibial arterial pulse. Those are going to be located on the inner side of the ankle. And I have identified both the right and the left. And I'm actually feeling those at a 2+. So that concludes the arterial pulses. Next, I'm going to do the Allen's test. So, Genesis, if you could sit up. Oops. Actually, you know what? I can probably do it with you laying down.
Can I put this over here?
Yeah. So, for the Allen's test, I'm going to ask the patient to let me examine the pulses located in their. Let me move the camera so you can see. Okay. Okay, so I'm going to check the radial artery and the ulnar artery. So if you can hold your hand up, I'm going to block both of those arteries. I'm going to assess the hand for loss of color. Tell me when it feels kind of funny.
Feels like it's going cold.
Feels like it's going cold. Does it feel kind of like it's falling asleep?
Still move it.
Yeah.
But it feels like
Okay.
I feel like it feels like I'm capturing air in my hand.
Okay. So I'm going to release the ulnar side. And I see the blood flow.
That's cool. I saw the skin the
color come back. Yeah. So that means her ulnar artery is patent.
Do that again.
I'll do it after this. She's got a lot of these to grade. All right, so we're deferring the Hohmann sign, the manual compression test, the Trendelenburg test, and the color change test. And I'm going to move on to perform an assessment of the abdomen. So
Can I put my arms like
Let's
this?
see.
This is comfortable.
I'm going to move the camera again. Hopefully you can see.
You can just set
Better.
it right there, Mama.
No,
Right there, the both boxes.
no, we'll just do it this way because it'll be too far. Okay, so Genesis, I'm just going to bring your pants down a little bit so I can assess your abdomen. Okay. You're doing great, and I'm so proud of you. Thank you for helping your mom out. I know. Thank you for helping your old mom out. I appreciate it. Okay, so I am looking at color, which is normal. Looking for ulcerations, scars, pitting, edema. No swelling. Her stomach is, well, her abdomen is pretty flat. It's not overly rounded, not protuberant. Symmetrically, it is symmetrical. I don't see any hernias or any bulges. There is no discharge of the umbilicus. Let me see if I can see the pulsations of your aorta. So go ahead and just relax your stomach. I can see them, yes. And she does not have any noticeable venous patterns that I can see. So now I'm going to listen to her bowel sounds. I'm going to start.
Isn't that where you poop out of?
Well, your bowels is basically your whole digestive system after your stomach.
Oh.
Well, no, I would say it's your large intestine, so I'm going to listen to those. Okay, so I am going to use the diaphragm side. I'm going to start on the right lower quadrant. Bowel sounds are present. We're going to move up to the right upper quadrant. Bowel sounds are present. I want to say that overall they're pretty hypoactive right now. I'm going to move over to the left upper quadrant. Bowel sounds are present, but they are hypoactive. I'm going to do the lower left quadrant.